So, hello everyone. Today we are going to talk about a very sensitive topic, that is sexual trauma. And to help us understand it better, we have here with us Dr. Arun Bhat, Assistant Professor at Shema, Nitte University, and his area of interest are sexual dysfunction, OCD, mental health awareness, and have been actively working to create a safe space for young people through social media. Yes, so over to you, sir. Would you like to say?
Hello. Yes.
Would you like to say something about this topic?
Yes, sexual trauma. It's a very sensitive topic. And see, first of all, when we talk about trauma, we have something called psychological trauma, physical trauma, and sexual trauma. And why usually it's a trauma. Trauma is hurtful for anybody, but especially for children and teenagers. What happens is they are a easy target because they don't speak.
Okay.
Sometime.
Yes.
And secondly, they cannot resist or fight back. So they become an easy target. And it is like, what can I say, the ice, iceberg in the ocean.
Yeah.
Only a small portion is visible. But we see a lot of cases in our OPD, and most of them might have some underlying sexual trauma or physical trauma or even psychological trauma, but it doesn't come to the surface because multiple factors makes them hide it from even from us psychiatrists or even from their loved ones. So it's a important topic which has to made aware to general public, and also people have to be made sensitive about it, so that the faster you identify it, the better is the prognosis for the victim.
Okay. So while working in this field, how many years have you been working in this field?
I'm working as an assistant professor currently in the Department of Psychiatry at KSAGD Hospital. So my journey of psychiatry started 2011, I can say. I joined as a junior resident. Then I took 8 months of I was doing 8 months of work in AJ Medical College, and after that I was doing 2 years of residency in Mumbai. Then I've joined here. So I have been seeing patients both here and in my clinic. And my wife is also a psychologist, so we both deal with these kind of issues. And sometimes what happens is, usually we don't see them at one go, these patients. What happens is, if for example, if I ask you, would you tell all the confidential stuff in one go?
Not really.
And when it comes to sexual trauma, it's very very sensitive for them, very traumatic for them. Unless you build a confidence and have a safe environment, they will have a lot of shame, some guilt regarding that. And especially I have seen in many families, the father is abusing the child, but mother is telling the child, and mother knows about it, and mother is telling, our family's honor is on the line, don't talk to anybody and don't tell anybody. So the child keeps suppressing it. Okay. So we do come across, but it depends on a lot of confidentiality, building the trust. Maybe after a few sessions, the child may come out and say.
Yeah. That being rightly said, and how it is a topic of shame. Anybody of us seems...
It is not a topic of shame.
Yeah.
It is a topic of sensitivity. But the child feels, if you are talking about teenager, child feels shame. But it should not be shameful.
Yeah.
It's the responsibility is not on the child, it's on the perpetrator.
Yes. And I feel like we as a teenager, because I am almost at the age of 20, and all this, like when we talk about these topics, it's like very stigmatized. Our own environment is not that sensitive enough to understand the topic of that person, and with movements like hashtag me too and all the other, and it has a completely different side with social media, and when we see all this thing we keep it to ourselves, and that must create a lot of problem, as you said about the iceberg model. So how do you think, like how much pressure does a child have to speak about all this thing, and how like as you said, with each session you get to know the layers of that child.
Yes.
And like how often do you encounter it, and how much time does it take for a person to actually come out of that trauma?
See, the thing is, what happens is, it's like the dust under the carpet. There's a dust. What you see, you put it under the carpet. What happens? It is likely to come out one day or the other. Similarly, this trauma, sometimes the children will not talk about it. So what happens? Eventually, the child keeps repressing it, and it comes out. It comes out not as a it comes out in different forms. Like it can be somatic complaints. The child will complain, the person will complain that I have body pains, I have headaches, long time headaches without any medical causes, or the person's academic decline will happen. The person will start isolating himself or herself from the society, from the friends. There is a lot of this is very true in case of children. Depression, anxiety.
Yes.
So depression in elderly, what happens? I mean, elderly means normally normal adults. What happens is they complain of sadness, but we should remember in teenager this aggression, defiant behavior, that can be a sign of underlying depression.
Okay.
So it comes out as that. So it is called like they internalize the trauma, and the actional symptoms will be different.
Yeah.
So sometime when the child or the person is having these symptoms, and we are giving treatment, and the child is not responding, then we may have to think that there must be something underlying the dust under the carpet, which we are not clearing.
Yeah.
So once we clear it, everything will settle back. So it's not very easy to clear the dust. The trauma is such intensity, it may even cause PTSD. You might have heard
Yes.
it. Post-traumatic stress disorder in that individual. So it needs a lot of work.
Oh, that seems like a very heavy thing to say, because I feel like when mental health is being said, we have very much awareness about depression and all the other things, but all this traumas, PTSD is something where it's very stigmatized. As I said, when you corrected me on the topic of shame, so I would like to know how shame is linked with this thing, like how society views it, and how the psychologist and psychiatrist views it, and for the person, like every perspective, it is very different for each one of them.
So what happens is shame is a psychological. See, when we think about trauma causing some issues in the body, it can have like physical implication. I mean causes, or cognitive causes, or neurological issues. So to talk about shame is kind of it's a kind of a cognitive distortion. They blame themselves.
Yes.
I am the one who is responsible for this, instead of putting the blame on the perpetrator. And the society also says, society or somewhat or orthodox family, they say you behaved like this, that is why you attracted this perpetrator. So then they will feel shame that I am responsible for this. So and then there is something called as cognitive distortion, where they have maladaptive pattern of thinking, where they feel that it is all my fault, it is not their fault. Okay, so that is a cognitive thinking, and because of that they start isolating themselves from the society, isolating themselves from the family, isolating from the peers. That leads to more more worsening of the symptoms, more worsening of depression. That leads to more negative pattern of thinking. That leads to, like, it's a vicious cycle.
Yeah. So, as we talked about cognitive distortion and shame, like as you said, it is a vicious cycle, and it is very much hard for the person to get out of it. And family, social, society, and all the stigma just add on to it. So, how do you, as a psychiatrist, like make the environment comfortable for the teenager?
Yes, that's very important.
Yes.
So when we see a patient, not I should not say patient or
Yeah.
the person, even putting a name into it like victim or perpetrator, that should stop.
Yes.
It's a person who is just like me and you. So when we see that person, first of all, confidentiality. That is more important. Secondly, building a safe environment where confidentiality is maintained and non-judgmental attitude. Whatever the person is telling, you see, I tell my patients, see, I'm not here as a lawyer or a police. I'm not here to judge you. My job is to help you. So whatever it is, however bad it may sound, you have to come out with that, so that I can help you better. So non-judgmental, confidential, safe space should be given. That will promote them to talk more.
Is there anything which you would like to tell us to the viewer, which should be looked upon when we talk about sensitive topic like this, or any of their peers or anybody is going through the same?
Yeah, first of all, see that's what teenagers, they listen to parents better. I mean, more than parents, they listen to their peers. Till 13 years they will be listening to the parents. After that, they look up to their peers and then other role models.
Yes.
So that is the time they have this identity creation of their identity. So peers would be the best person to identify. Second is teachers, and then the parents.
Okay.
So the thing is that they should be, the peers or people should be aware there is sudden change in the behavior of that person. There is more irritability, aggression, or sudden decline in their functionality. We call it as social functionality, family dynamics, and academic functionality. All these things keeps dropping, and they are isolating themselves. They might be tearful, crying. If they notice such kind of thing, we should suspect that something is going on. And then when they encounter such person, they should be more empathetic.
Yes.
That is the word I was looking for. Empathetic. Empathy is the most important thing, not the sympathy. Empathy.
Yes.
I also understand.
So, would you like to brief on how empathy is different from sympathy? Because I feel many of us mostly practice sympathy rather than practicing empathy.
Sympathy is like you see something, oh poor fellow. That is sympathy.
Yeah.
Empathy is, he is going through so much trouble. I understand. I can put myself in that person's shoe. That is empathy.
Yeah.
Okay, you understand that person's pain, and you are expressing your feeling because you understand. Sympathy is just feeling bad for him. That's all. That is sympathy. Empathy means understanding one's pain as yourself.
Yeah.
That is empathy. So being empathetic, that is important. And then the most important thing is, once you identify the whoever, the loved ones or the family members or the teachers or the peers, they should be non-judgmental. They should maintain confidentiality, and they should promote them to consult professionals, so that they can work, the victim can work on their trauma and come over it. Because trauma is not everything. Trauma does not define their life. They can come out of that trauma, and healing is possible, and they should understand that they are never alone.
Yeah.
So that is very, very important, because if trauma goes untreated, it can lead to lot of, it is like it is like
one of my psychologists actually tell about this thing, like it's ABC component, something similar to that. When we talk about bad emotion, it's like catching fishes. So one by one you catch fish, and one day you will only drown into it. So is it similar to that? Like when we talk about bad emotions, does all this, when we talk about shame and all this topic, one by one it comes to you surface, like as you said. So it comes in surface and you start dissolving all those topics of shame, and then we have like family, what will family think, what
Yes.
will this person think, and we all think about the other people, but we never think about
Think
us,
about,
because
us,
that
yes.
trauma has made our life so that we only live with trauma. So
Yes.
how can a person can live without trauma? Like when how should they start thinking about themselves? Because
See, we cannot avoid others. I mean, we cannot control. We cannot
Yes.
control others. So trauma can happen and will happen. But what we can do is, if a person is traumatic, they should understand that I can control myself better than anybody. I mean, I can't control the world, right? But I can control myself. If I am having problem, if I have gone through the trauma, if I have had bad experiences, I can get better with help. And I am not alone. There are people out there who is willing to help, and trauma does not rule my life. That they should understand.
this is kind of very positive affirmation to say to the teenagers out there, because it needs lots of courage. But once you had courage, once you ask for the help, I feel like there is a better world.
It is
out
like
there.
from the negative vicious cycle, your negative feedback loop, you are pushing them into a positive feedback loop.
Yes.
Once that journey starts, it will go on. It
And-
just take a moment of courage to come out and seek help. Seeking help from a proper professional individual, and that starts from with your peers or teacher whom you trust completely. And sometimes it is difficult because for a person who is traumatized, it is difficult for them to trust anybody, because they are already once their trust has been betrayed. But yes, if once trust is betrayed, that doesn't mean it will happen again.
Okay.
They have to take a step forward, then only we can help.
Yeah, but if a person is already going through a lot, because as you have described throughout our conversation, that how it can affect you mentally, physically, socially, and everything. So if you, like for example, if a parent or teacher have suspected somebody might have trauma, and how they can seek, like go to them, talk to them, and like without adding to the shame, because when you talk with these people, you have this one thing, the patient itself might be having this
See,
very
that is the thing. It's a very sensitive topic. You should not ask them to tell me the encounter. Tell me tell me in detail what has happened. Is it really you are telling, or are you telling lies? That kind of things will make them hesitate. Okay, tell me whatever it is. See, we have a son and a daughter. We ask him to talk about anything and everything. Because when do the children lie?
when they have done something bad, maybe
Bad, or fear of being punished.
Yes,
When they
and
don't have any fear of punishment, and when they feel that the parents are non-judgmental in listening, then they will open up to the parents.
yeah.
So that non-judgmental, confidential, safe space should be established for that child or the teenager or the person. Then they will open up.
Okay.
And not to make them repeat their traumatic incidents until they are ready for it. That will help them, Then, especially teachers, if their marks are declining, the grades are declining, they can notice this child was very brilliant. What is happening to the child? That can give some hints as to something is happening with the child. Or in other case, like I told you, defiant behavior. Previously a very good mannered kid suddenly becomes defiant, suddenly throws tantrums. That means there is something going on in the background. We need to assess that.
So what about the child who have been through certain things but doesn't display in the behavior? It's like very, how high function depression works, right? Like they doesn't seem to be happy. It does like they seems to be very happy, and which is like completely opposite of depression. And with that thing, they have grown into an adult. And
I don't think that is not. I mean, see, it is like this. It is bound to come out. You are talking maybe about mass depression or something
Yes.
like that. But child, it is not very easy for the child to hide it.
yeah.
Child will come. So child may internalize the trauma, but it will have other symptoms like headache, frequent headaches, frequent abdominal pain, or frequently absent. Getting absent from the class. One more important thing, very very important. I forgot to tell about
Yes.
it. Risk-taking behavior, taking substances, and identity crisis, drugs, and like riding very fast.
Yes.
These are the externalizing symptoms.
Okay.
And even they can have unsafe sexual encounters with others also, multiple sexual partners. These kind of things can happen if the child has not dealt with that, or the child has not talked about it. So that's what the trauma might be something, but the picture is different. It can present in various aspect, the personality aspect, the behavioral aspect, their psychological aspect.
Okay. Well, this will be a question thoda related to media. How media shape these issues? Because when you talk about media and specifically all the films and drama, the way it is visualized and all,
Right.
what adds to that?
Have you seen that Dopati?
Draupadi?
Dopati.
Dopati, yes.
Dopati. I
Yes.
think who's that actress?
Kriti Sanon and
Yeah. There they have shown she was a victim. She was a victim of domestic violence,
Yeah.
and the message was very good. They stood against that violence and they won in the court. So that kind of movie should be promoted more. Not the movies where they make the hero out of the abuser or something like that, like serial killer or that kind of movies or media should be discouraged.
Usually when we talk about media, I feel majorly we take this issues of sexual trauma and all the other thing linked with the backstory of a person who is villain or maybe something. Then we have that sympathy kind of thing that oh my god, this happened so bad with him, that made him the villain.
That should be reduced. That should not be it should not be promoted in a good outlook. One thing. Second thing is this news channels.
Yes.
They keep the video on loop, showing the same person with maybe what you call what is that? They put the face will be hidden, blurred. Yeah. Face will be blurred, but they show this is the victim of sexual. This one, keep on this one. That should also be reduced because that is very traumatic for the person who is watching that.
Yeah.
Or the identity should be kept very confidential. So that is what I would, I would think it is important for the media.
Well, media, we talked about media, we talked about family. Let's talk about institution and schools where a teenager spends like almost half of his day. So how can, I'm so sorry, how can schools and institution create a safe space for a teenager to talk about this? Like when we are even conducting this interview and all, many people doesn't take upon this topic and we don't talk that much. So what should an institution and school should do?
So one thing is like they should have a counselor in their school where there is a safe space for the child to go and talk. Second, creating some awareness program or like role play where awareness, like my son is 7-year-old.
Yeah.
He knows about safe touch and bad touch, good touch.
I feel that thing should be taught to the kids from the starting very young age.
Yes.
Because
that is very important because what happens is the children of not even I'm teenager, I'm talking about 8-9-year-old, they get sexually abused. They don't even know what is sex. So they should be taught about good touch, bad touch, and they should be they need an environment of love and a non-judgmental environment from the parents. When that happens, even if there is some bad incidents happening outside, they can come and talk to the parents,
Yes.
and then that action could be taken. Otherwise they will become very confidential. They will not talk about it and keep on enduring repeated trauma. That is one thing. And that's what creating awareness program.
Yes.
And other thing, referral programs also. Like if the teacher finds out that there is problem, they should refer to the mental health workers.
Yes. And what would be your take on sexual education in India?
Very, very, very important. That is why I think in my YouTube video also I had talked
Yes.
about, oh my god,
Yes.
Because
I would suggest all of the people who are watching here, please go to the link below and check out the channel and specifically that video.
oh my god too.
Yes.
Because that is I think that kind of movies should be promoted, because it has a very powerful message. Sexual education, most of the
Okay, so a school should have a proper counselor. Secondly, talk about sex ed, basically.
Yes, we should not make it as a big ha ha thing. It's
Yes.
a normal phenomena.
Yes.
Sex is a normal phenomena needed for reproduction, and humans are the only animals which have who have sex for apart from reproduction for pleasure. So it is a very sacred thing, and it should be treated as such, and also should not be made into a taboo.
Yes.
But the children should know what is it, how it happens.
Okay.
When they are age
Be
appropriate,
taken out so we don't face any mental health problems later. And specifically to mention, the good touch, bad touch need to be taught to the child.
very important.
Yeah.
And along with that, they should also be taught that if there is a bad touch, you come and report to me immediately. I will help you no
Yes.
matter what. Even if you think that you are wrong, I will come and help you. That is very important.
Yeah. Okay, so we have talked about lots of topic. There's so much to think upon each topic wise, and there's lot of things a parent can take up from this conversation. A college or like school institution can take up on this conversation. A child can take up on this conversation. Whoever is going through the sexual trauma can take up on lots of things. Okay, well. So through this conversation we have understand how sexual trauma can be very sensitive topic. It can be very harsh on the victims. I should not say victims, but rather a person. Yeah, and we have talked about identity, sexuality. We have talked about how it is taken as stigma. We have talked about family, and then we have talked about therapy and healing. Let's go a bit more into therapy and healing and take up this one question, that is, what is the therapeutic approach which can help a teenager overcome the shame? How do you take these approaches and go through it?
I told you before that there is something called as cognitive distortion.
Yes.
Which is a maladaptive pattern of thinking. If, for example, if I for example, how can I put it? Some accident happened.
Yeah.
I feel that is all my fault. There are multiple types of cognitive distortions, like all or none, catastrophization,
Yes.
black and white thinking. So similarly here also there are cognitive distortion. So we have to help the individual to restructure their cognitive pattern of thinking. Cognitive
Yes.
pattern means like the way they think. So it can be done through trauma focused CBT, then EMDR, then some relaxation training, narrative therapy. So these are some of the therapies where we can help the individual come out of the trauma what they face through.
How does like a therapist help in sexual trauma, and how does a psychiatrist help in sexual trauma?
See, both of us I will not put it as a separate thing.
Yeah.
Both should go hand in hand. So psychiatrist, see, both of us should encourage the person to give a more safe space, non-judgmental space. Then psychiatrists sometimes, most of the time, psychiatrists deal with pharmacology, that is medicines,
Yeah.
and therapists deal with the psychological therapies. So that should both go hand in hand. So psychiatrists may help the individual with antidepressants, anti-anxiety medication, and therapists may give all these therapies which I told you before. With that, we can help the individual.
The teenagers who are going through same, should they go first to the psychiatrist and should they go first to the therapist? That is a very big question, I feel, because
They should go to any of them.
Yes,
And yes, they should go. That
okay.
is taking the first step. Then once they come to us, either psychologist or the psychiatrist, we can refer them later. But they should come out.
Yeah.
They should feel that we can help them. So coming out is very important.
Yeah.
So anybody, they should approach. That is very important.
So, if you could say one sentence to every teenager who have experienced sexual trauma and carry shame within them, what would it be? And any affirmation you would like to give to the viewers watching?
First of all, it is not a shame.
Yes.
It is a pain. Okay, so don't think it as a shame, and it is a pain. And trauma does not define anyone, does not define you, and you are not alone. And healing is possible.
Yes. Okay, so with that question, with healing is possible, let's wrap up to this conversation, because if we take it long, it will go long, because there is a lot to discover on this area. And viewers who are watching and the people who have been through this, from my very heart, I am very empathetic to you, and take a courage to step and take help from psychiatrist and the therapist, whoever is near you. And please do it. Yes. So thank you so much, sir. Thank you so much for this topic to like reframe this whole topic to us. And yeah, thank you.